This is Radio Health Journal. I'm Nancy Benson. This week, how our overall health has taken a hit during the pandemic.
They've become more sedentary, they've turned to comfort foods, and so their cardiac risk factors have actually gotten worse.
How a pandemic diet can ruin your health in a hurry, when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The technology is simple in a lot of ways, and we already have these issues. What's going to happen as it becomes more powerful and more complex? We have to start thinking about this now.
The field of artificial intelligence and its modern applications. Then,
I was sitting there at the end of my 30s and being like, did I do this wrong? I'm happy, but am I alone?
The woes of sticking to the traditional timelines of adulthood. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
We're all familiar with how COVID-19 has taken more than 500,000 lives over the past year. But the pandemic has also changed how we live, in both good ways and bad. Unfortunately, it's likely that the bad habits we've adopted have cost additional thousands of lives.
They've become more sedentary, they've turned to comfort foods, and so their cardiac risk factors have actually gotten worse as opposed to better. There are the few that have taken this opportunity as a reset, and they've really taken their health, made that a priority, and they've actually gotten better, but it's definitely the vast majority have actually gotten less healthy during the pandemic from a general health perspective, not just as related to COVID.
That's Minneapolis cardiologist Dr. Elizabeth Clotis, author of Slay the Giant, The Power of Prevention in Defeating Heart Disease, and founder and chief medical officer of Step 1 Foods. She says 1 year is more than enough time to wreck your heart health with a pandemic diet of comfort food.
Oh my gosh, you could do it over the last month. You can see significant cholesterol changes in as little as 30 days in response to what you eat. And that goes both ways, right? Like that's the good and the bad. The bad is if you start eating very poorly, your cholesterol can skyrocket in literally 30 days. But the other flip side is also correct, is if you improve diet, you can see significant improvements in just that amount of time. So it can be very marked and very quick. Other risk factors take longer, right? So blood sugar it'll take longer for you to develop blood sugar abnormalities. It'll take longer for you to gain weight, significant amounts of weight. It'll take longer for your blood pressure to deteriorate, although if you start eating a lot of salt, it can also happen very quickly. So it's not a matter of the whole year. It can happen really, really fast.
However, it's not as if most people ditched a healthy diet during the pandemic. Most of us have never eaten right, even though we should know by now how it's done. Dietary advice is everywhere. In fact, Clotis says that's one of the problems. Too much advice has only gotten people confused.
It's like, eat eggs, don't eat eggs, eat grapefruit. Oh my God, do not put a piece of grapefruit in your mouth. Did you know lectins are bad? Do not eat a tomato. Just eat fat. No, just eat protein. Oh my God, only eat carbs, right? It has been one confusing message after another.
Clotis says doctors haven't been much help. They've told us we can get healthy if we follow good habits, but those habits seem impossible to reach.
Most people perceive that to have an effect from diet, a health effect, it has to be this massive lifestyle overhaul, which is impossible to achieve, so just why even bother? And again, that's not true. This is where small changes can add up to huge, huge health effects in a very short period of time.
Everything you really need to know, Clotis says, can be summed up in just 7 words.
Eat food, not too much, mostly plants. Eat food means eat real food. Eat food that your great-grandmother would recognize as food. She would not recognize Mountain Dew. She would not recognize a Twinkie. She would not even recognize Cheerios or Wonder Bread. She wouldn't recognize barbecued beef tips in some weird sauce in the freezer section. Like, she would recognize a chicken that was cooked in the oven at home. She would recognize green beans. She would recognize eggs, and she would recognize fruit, and it would be whole and real and simple. That's it. It's not vegan. It's not paleo. It's not low carb. It's not high carb. It's not anything.
Clotis says we have to make eating right feel much simpler, more achievable, and even tasty. There's no way people will follow a healthy diet if they see a future full of meals that taste like cardboard.
It's just a tiny change, and it's literally like, change out your breakfast and snack. Like, instead of your bowl of Cheerios, have this oatmeal. Instead of your chocolate bar in the afternoon, have this chocolate bar instead. Like, that's it. You want your burger for lunch? Have your burger for lunch. Like, I'm not going to ask you to change everything. It doesn't have to be this ginormous change. So instead of having steak with vegetables, have vegetables with steak. You're eating the exact same thing. It's just a slightly different proportion on your plate. Ultimately, what makes this way of eating sustainable is you feel better.
Even so, most doctors these days give out a pill instead of making small dietary adjustments. But Clotis says a healthy diet can be just as effective. For proof, she had people change just a few small things in their diets and got big results when people stuck with it.
This is not a mystery. We know what to eat. We know what to eat. It's just hard to do. We found on average, we did a clinical trial, we found on average a 9% reduction in LDL cholesterol in 30 days. Like, this is where I'm talking about, it doesn't take a long time to see an effect. 9% is, from a public health perspective, is actually an unbelievably meaningful result. If we lowered the LDL or bad cholesterol level of the U.S. population by 9%, for the first time ever, heart disease would be dethroned as the number one killer of Americans. Like, that's amazing. But even within that, there were people that had 20, 30, close to 40% bad cholesterol reductions. That's the effect of a drug. And they did it with food. They did it with a chocolate bar and an oatmeal, or a pancake and an apple cinnamon bar. This doesn't have to be hard.
That doesn't mean it's easy, but it's a place to start. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
2 nationwide surveys find that discrimination is a significant barrier to care for people with Alzheimer's and dementia. Half or more of non-white Alzheimer's caregivers report they face discrimination in navigating health care for their recipient. Dr. Carl V. Hill is Chief Diversity, Equity, and Inclusion Officer of the Alzheimer's Association.
The data suggests we have a long way to go to address lack of health equity in healthcare. More than 80% of non-white racial and ethnic groups say it's important for Alzheimer's care providers to understand their backgrounds and experiences. But fewer than half of Blacks and only about 60% of Hispanics and Asian Americans feel confident about their access to culturally competent providers.
The surveys also reveal a lack of trust among Blacks in research clinical trials, and half doubt that advances in Alzheimer's treatments would be shared. These findings are part of the 2021 Alzheimer's Association Facts and Figures Report. Find out more at alz.org/facts.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
It's very easy to numb out with substances, and it's very easy to isolate because we are asked to isolate. We're choosing to isolate for another safety reason.
Assessing the psychological wreckage of the pandemic.
Then, the pandemic has boosted technology in the classroom, but is handwriting being left behind?
Anytime you use a different tool, it naturally is going to change the way you think. It's going to affect the way you process information.
All that and more on Radio Health Journal.